developed this thing called the triple aim. Triple aim is it's very well known in the medical community right now. It's especially among the administrators who are trying to figure out how to provide better care and reduce costs. And the triple aim really came out of this Crossing the Quality Chasm report with the idea that if we can implement these 3 points, then we can start to close that chasm. We can start to close the gap in some ways, right? Essentially, we can look at yoga in terms of these 3 ideas, and how does yoga fit into these 3 aims or these 3 goals of healthcare. Oh, I know what I wanted to mention, that the triple aim was adopted by the Affordable Care Act. And it's actually a part of the Affordable Care Act. That's why it's so important right now, because we're trying to implement the Affordable Care Act, and this triple aim needs to be met as part of the goals of the ACA. So what is the triple aim? These 3 things. First of all, reducing costs, because at $10,000 per person, we can't afford it. Now, this next piece I think is really important, the patient experience of better care. There's a realization that people are not receiving the best care they could. And then the third point of the triple aim is the health of populations, and this is as opposed to the health of only individuals, right? It's not just about individuals, it's about population. Doesn't that sound kind of yogic to you? Like we're like moving towards union, like we're recognizing that we're all affecting each other. Of course, this is going to be largely informed by understanding systems theory that I talked to you about yesterday, the biopsychosocial spiritual model that we talked about yesterday, the social ecology models that we talked about, just understanding how and the social determinants of health, understanding how we influence each other's health all the time. And all of the factors in our lives, our individual behavior, our family behavior, our cultural behavior, the institutions we belong to, all of those are informing our own individual health. So if we look at health of populations, it gives us a broader, we cast a bigger net, to be able to help people, as opposed to just trying to help individuals who might get there too late. They might get their health care too late. Okay, so let's break down each of these points and talk about yoga. So yoga and the triple aim. The first one is improving the health of populations that I wanted to talk about. I was just talking about that momentarily. Population health rather than individual health focus. As we know, as yoga instructors, yoga therapists, we can adapt the practices depending on who's in front of us. So the practices are not only for fit, healthy 20-something-year-olds. They also can be adapted for people in chairs, for people who have chronic diseases, for people even later in life, even in palliative care and hospice care. Not, of course, even at the end stage, but before end stage hospice, while people are still conscious. I worked in hospice for a number of years, doing breathing practices with people and acupressure and simple massage techniques, and so much benefit from that kind of interaction. So across the whole lifespan and across the populations, we can adapt these practices to fit the people who are in front of us. The other big advantage of yoga, as opposed to some of the other complementary medicines, is that it can be provided in groups. And definitely we can adapt to the people in front of us. In my opinion, the sicker people get, the more the groups have to shrink, So when you think about yoga and the prevention, the stream of prevention, right? Primary, secondary, tertiary prevention. So moving towards the upstream in prevention, so that then you can work with larger groups of people, and the larger groups, of course, it becomes more cost effective.